Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Renal failure, also known as kidney failure, is a condition where the kidneys lose their ability to function properly. Sudden damage to the kidneys, caused by factors such as infections, blood clots, dehydration, or certain medications. It may also be caused by chronic kidney disease. The gradual damage to the kidneys over time, often due to conditions such as diabetes, high blood pressure, or autoimmune disorders. Renal failure is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to renal failure and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Cannabis, particularly compounds like CBD, may help manage symptoms of renal failure. Chronic pain. Cannabinoids may reduce pain associated with kidney disease, offering an alternative to opioids, which can be harmful to the kidneys. Nausea and vomiting. Cannabis may help alleviate nausea, a common symptom in kidney failure. Loss of appetite. Stimulating appetite, especially through THC, could help combat anorexia and malnutrition, which are serious issues in kidney failure. Itchy skin. Uremic pruritus is a distressing symptom in kidney failure, and cannabis may offer relief. Insomnia. By addressing pain and discomfort, cannabis could help improve sleep for patients experiencing poor sleep due to metabolic issues and other factors related to kidney disease. Restless leg syndrome. Cannabis may provide relief for the unpleasant urge to move the legs associated with this condition. As with all conditions treating symptoms with cannabis, most evidence comes from animal studies, anecdotal reports, and surveys of kidney doctors. More human clinical trials are needed to confirm the effectiveness and safety of cannabis for kidney disease. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Several terpenes show potential for managing renal failure and chronic kidney disease by mitigating damaging factors like oxidative stress, inflammation, and fibrosis. Limonene. Studies on rats have found that limonene can protect against gentamicin and doxorubicin-induced acute kidney injury. It works by reducing inflammatory responses, mitochondrial apoptosis, and oxidative stress. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. Studies in rats and mice have shown BCP to protect against drug-induced kidney toxicity and hyperoxaluria, a condition that can lead to kidney stones. It decreases levels of inflammation, oxidative stress, and cell death markers. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. In lab studies, linalool was shown to inhibit inflammation induced by lipopolysaccharides, LPS, in microglial cells. while this suggests a potential benefit against inflammation-related kidney conditions. Examples of strains high in linalool include Do-Si-Dos, lavender, Skittles, Granddaddy Purple, and Amnesia Haze. Myrcene. In a rat model of kidney injury, myrcene reduced oxidative damage, inflammation, and levels of creatinine and blood urea nitrogen, indicating improved kidney function. It also increased the activity of antioxidant enzymes. Examples of strains high in myrcene include Blue Dream, Granddaddy Purple, Grape Ape, White Widow, and Tangy. Pinene. Studies in rats have shown alpha-pinene can protect against drug and ischemia-reperfusion-induced kidney injury by reducing oxidative stress and inflammation. Examples of strains high in pinene include Dutch Treat, Grape Ape, Harlequin, Blue Dream, and Chemdog. Cannabidiol, CBD. Animal studies have shown that CBD can reduce inflammation, oxidative stress, and fibrosis, which are processes that contribute to kidney damage. One mouse study showed that CBD protected against kidney damage induced by chemotherapy. Symptom management. While not a cure, some evidence suggests CBD may help manage common symptoms of chronic kidney disease and end-stage renal disease, such as pain and inflammation. Drug interactions. For kidney transplant patients, CBD can increase the level of the immunosuppressant medication tacrolimus, which can lead to toxicity. This requires careful monitoring and dosage adjustments by a doctor. Recent animal research suggests CBG may have stronger anti-inflammatory and antifibrotic effects than CBD for kidney damage. Like CBD, THC has been explored for managing symptoms like pain and nausea in patients with chronic kidney disease and end-stage renal disease. Some studies suggest that in people who already have chronic kidney disease, regular cannabis use, which typically involves THC, may be linked to a more rapid decline in kidney function. The hemp-derived CBD, CBG, and THC market is largely unregulated, and products can have inaccurate labeling or contain contaminants like heavy metals and pesticides, which are harmful to the kidneys. It is important to purchase products in legal, state-regulated stores. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.